So it became very apparent to me quickly that to meet the quadruple aim, which is better care, lower cost, more satisfied providers and patients, that we had to change the administrative complexities and barriers that exist in getting healthcare financing to be in a place where people don't feel that it's a pain point. And so to try and get to the quadruple aim, we had to change the way the whole administration of payments and information flow is administered across the network. And so blockchain really has the ability to take a very complex, fragmented process and to automate it in a very elegant way so that people can get healthcare and communicate, as opposed to spending time on healthcare administration, which makes nobody happy and doesn't bring much value to the system. One of the most important things for us to get physicians aligned around changing healthcare delivery as well as behavior of patients is to make sure we free up time so that they can engage patients through communication. And one of the best ways for us to free up time so that the patient and the physician can really talk to each other and communicate and influence each other is by taking away those processes that don't add value. So would you rather spend 5 minutes in registering a patient and finding information that should be available in front of you, or would you like to spend 5 minutes talking with a patient and listening to them? I think the latter half gives you much better value. So driving provider satisfaction by making things easier for them so they can get back to the practice of medicine is a critical success factor for changing the healthcare delivery system to a better value. And so blockchain is going to help us take those administrative processes that essentially intrude into the relationship between the patient and the physician and free them to do what they are trained and where their passion is, which is to deliver healthcare to humans and not do administrative tasks all the time. So it's essential to our strategy to drive provider satisfaction. And without provider satisfaction, we can't drive better patient care, lower cost, and more satisfied patient experience with the delivery system. So it's really critical that we address this component of the four-legged stool in terms of better care, lower cost, more satisfied patients and providers. Yeah, I think the relationship with Solve.Care is truly an innovation partner that is strategically aligned with what the ACN is trying to do. So what really excites me about this is the innovation that Solve.Care brings to the table, as well as their strategic alignment with the Arizona Care Network. They really are trying to and will be successful in driving a transformation in healthcare delivery, financing, payment, and information sharing. That Solve.Care and the team that leads it and works at Solve.Care have done this for a very long time. They've been innovative in other areas of healthcare administration and technology, and it's my preference to partner with a strategic partner that has some scars in terms of having done this before and that have experience with addressing very, very complex interactions in terms of technology and humans in terms of systemic change. And so that's the reason why I'm excited about Solve.Care. This is a tried and trusted partner that is strategically aligned and will deliver on their promises. Yeah, I think the network's very excited for multiple reasons. One, we want the interaction between the physician and the patient to be maximum. So when you have 20 minutes with a patient, that you spend most of that time in communication and problem solving jointly with a good set of information. They're excited about the fact that the administrative burden to verify insurance eligibility and active membership will be managed and handled by a technology that is not a good use of time of a human being to spend time verifying something that should be available and should be in the hands of the patient and the physician. They're excited about the fact that through our blockchain technology, we're able to communicate directly with both the patient and the provider about their care needs, their care gaps. We can also report through our Physicians Reward program the performance of the physician so that they know how well they're doing, they know how they're being rewarded, and we also provide them with information to optimize their care. And then lastly, the rapid payments. Anytime you don't have to spend a lot of money and manpower on getting paid what you are due, and that payment is accurate, real-time, and complete, that improves the satisfaction of everybody in the pathway. Well, I've been very impressed by the enthusiasm and innovation that occurs within the team in Kyiv. It's fascinating for me to see the understanding of the human condition as well as the challenges that relate to healthcare delivery, financing, and obtaining good and delivering good results. That those challenges are uniform, whether they're in the Ukraine, whether they're in Phoenix, in London, Africa, anywhere in Asia. And so it's refreshing to see that we're working on the same challenges, that we have a very clear goal in terms of the quadruple aim, improving all four elements of it and not just some of it, and that we have like-minded people all over the world that will work with us. I'm very excited about this. I think it's an opportunity to bring new innovation from other parts of the world into the Phoenix area and vice versa. And since we focus on the best interest of the humans and want to improve our community one patient at a time through our healthcare focus, I think that we are going to have a great relationship with a lot of cross-pollination, us learning from the staff in the Ukraine and vice versa. And we literally are going to make the world a better place one patient at a time. And what the technology and modern information technology brings to us is an ability to cooperate and collaborate across the world no matter where you are. That's refreshing, I think, is a major barrier that has been removed to collaboration and better results.